Hello, let's get started. Today we're going to talk about newborn transition. So let's take a look. The mechanics of birth require a change in the newborn for survival outside the uterus, and pretty immediately. We have respiratory gas exchange along with circulatory modifications, which must occur to sustain extrauterine life. The transition is the newborn period when the newborn is transitioning from intrauterine life to extrauterine life, and the acute phase typically lasts for about the first 2 hours of life. A newborn is considered a neonate for the first 28 days due to some of the continued transitions. So let's take a look at some of the changes some of the systems go through. You can see this table here that shows us that with the respiratory system, we go from a fluid-filled, high-pressure system which shunts the blood, like we talked about when we talked about fetal circulation, to the newborn where the respiratory system is air-filled and low pressure. And we have that blood that goes to the lungs for gas exchange. The site of gas exchange, we go from the placenta in the fetus to the lungs in the newborn. And the circulation through the heart changes. We have the pressures in the right atrium, which are greater than the left in the fetus, and then it switches in the newborn to where the pressure is greater in the left than in the right. And then we talk about the hepatic portal circulation. And remember that ductus venosus, which bypasses the liver and doesn't utilize the fetus's liver. And then we get hepatic portal circulation beginning in the newborn. For thermoregulation, in the fetus, body temperature is maintained by maternal body temperature. And remember that amniotic fluid has an impact in maintaining the body temperature of the fetus. Whereas once the baby's born, the body temperature is maintained through a flex posture and through brown fat. We'll talk more in depth about all of these. So cardiovascular adaptations. We touched really briefly on the cardiovascular changes. Now let's take just a little bit of a closer look. Remember that there are 3 main shunts present in fetal circulation, which allows blood to bypass the liver and the lungs. Once the baby is born, the lungs start to function as a gas exchange organ, and the liver begins to filter the blood. The physical forces of birth lead to an increased release of catecholamines, which is critical for changes involved in the transition to extrauterine life. There are multiple structural changes that occur within the cardiovascular system. The umbilical cord is cut and those shunts close. So let's look even closer. This is a good visual depiction of the changes that occur directly after birth. Clamping the umbilical cord at birth eliminates the placenta as a reservoir for the blood. The onset of respirations causes a rise in the PO2 in the lungs and decrease in pulmonary vascular resistance, which in turn increases pulmonary blood flow and increases pressure in the left atrium, which decreases pressure in the right atrium of the heart. And this causes the closure of the foramen ovale. This closes within minutes after birth, secondary to that decreased pulmonary vascular resistance and an increase in left-sided heart pressure. With an increase in the oxygen levels after the first breath, we get an increase in systemic vascular resistance, which decreases the vena cava return, which reduces blood flow in the umbilical vein. So it constricts and becomes a ligament with functional closing. Closure of the ductus venosus, which also becomes a ligament, causes an increase in pressure in the aorta, which then forces closure of the ductus arteriosus within 10 to 15 minutes after birth. Pretty crazy process, huh? So here we have our ductus venosus, I misspoke, our ductus arteriosus and our foramen ovale. Here you can see immediately after birth, this is starting to constrict. So we get then the blood going into the lungs. And here we have the foramen ovale, which closes. And it's called the fossa ovalis afterwards. And then from the ductus venosus perspective here, we get that closure and it becomes a ligament. And then you can see the umbilical ligaments here. So that was the umbilical blood flow, or the umbilical veins and vein and arteries prior to the umbilical cord getting cut. So moving on to respiratory adaptations. There is an adjustment from a fluid-filled intrauterine environment to a gaseous extrauterine environment. When the baby is born, when the baby cries for the first time, it really helps to expel the fluid from the lungs and keep those alveoli open. I always love how parents want to comfort their newborn babies, and they end up shushing them like, shh, it's okay, it's okay. And us nurses stand over on the side going, no, let them cry, let them cry. We love it when they cry because it means that they are effectively opening up their lungs, and it really helps to clear everything out. So surfactant is also crucial in keeping those alveoli open by reducing the surface tension, therefore preventing alveolar collapse. Remember back to physiology. Gas exchange occurs in the alveoli, so it's crucial that they stay open. The expected respiratory rate is 30 to 60 breaths per minute. And newborns' breathing will be irregular, and it could have up to 15 seconds of apneic periods, so 15-second periods of apnea. We should see symmetrical chest movements in the newborn, though. So the effective maintenance of respiratory function is key for newborn survival. The newborn will experience initiation of respiratory movements, expansion of the lungs, establishment of functional residual capacity, increased pulmonary blood flow, and redistribution of cardiac output. And this is a good depiction of what the alveoli looks like in the fetus compared to the neonate or the newborn. So you can see here the pulmonary capillaries, how dilated they are compared to in the fetus, where they are pretty well collapsed because the need for blood flow, or that amount of blood flow, just isn't there. And then we have the aqueous environment versus the gaseous environment. And you can see those surfactant molecules here. Remember that surfactant is so important for keeping those alveoli open. And we'll talk more about the role that surfactant plays and how the lack of it can impact premature babies when we talk about newborn complications. Okay, so newborn thermoregulation. Newborns are dependent on their environment for the maintenance of body temperature, much more so immediately after birth than later in life. The characteristics that predispose newborns to heat loss include their thin skin and the fact that their blood vessels are so close to the surface, which therefore allows for heat loss. Newborns are unable to shiver, which is a function that produces heat, and they have limited stores of metabolic substrates such as glucose, glycogen, and fat. Newborns have a large body surface area relative to their body weight. They have a lack of subcutaneous fat and little ability to conserve heat by changing posture. Newborns are unable to adjust their own clothing or blankets to achieve warmth, and infants cannot directly communicate that they are too warm or too cold. When adjusting a newborn's environment, it's important to take into consideration the 4 mechanisms of heat exchange. So we're going to look at conduction, convection, evaporation, and radiation. Conduction is the transfer of heat from object to object. You can see that up here. When the 2 objects are in direct contact with one another. Convection is the flow of heat from the body's surface to cooler surrounding air, or to air circulating over the body's surface. Evaporation is the loss of heat when a liquid is converted to a vapor. And radiation is the loss of heat to cooler solid surfaces in close proximity, but not in direct contact. Can you think of some real-life situations where a newborn will experience heat loss? What do you think? So thermoregulation is the balance between heat loss and heat production. Newborn heat production is primarily through non-shivering thermogenesis. Brown fat can be metabolized to produce heat. Brown fat is located in the interscapular region and the axillae, the thoracic inlet, and along the vertebral column. There's also some around the kidneys. Heat loss is via the 4 mechanisms that we just talked about, and it can lead to cold stress, and we'll expand upon that shortly. Newborns need a neutral thermal environment for optimal growth and development. They have limited insulation and limited sweating ability, and their large body surface area can predispose any newborn to overheating. Cold stress is excessive heat loss that requires a newborn to use compensatory mechanisms, such as non-shivering thermogenesis and sometimes tachypnea. They use these to maintain their core body temperature. So let's take a little bit of a closer look at newborn cold stress. So you can see in this picture what's happening when that newborn baby gets cold. Cold stress causes an increase in O2 consumption due to the brown fat metabolism. Oxygen and energy are derived from brain and cardiac function and growth for heat maintenance and survival. If the newborn cannot maintain adequate oxygen tension, vasoconstriction follows and jeopardizes their pulmonary perfusion. As a result, the PO2 decreases and blood pH drops. Continued cold stress causes anaerobic glycolysis that increases acid production. This in turn leads to metabolic acidosis. And you can see that process right here. So we have cold, which increases our O2 consumption, so our respiratory rate goes up. We have vasoconstriction, so we have decreased oxygen by the lungs, decreased oxygen to the tissues, so we have anaerobic glycolysis, we get peripheral vasoconstriction, and a drop in PO2, drop in pH, which is acidosis. This process also leads to hypoglycemia because that anaerobic glycolysis uses 3 to 4 times the amount of blood glucose. We'll talk about the impact of hypoglycemia a little later when we talk about newborn complications. So moving on to the hepatic system. The newborn's liver is slightly immature, but has some very important functions. The newborn has iron stores that will supply iron for the first 6 months of life. The liver is responsible for carbohydrate metabolism and for bilirubin conjugation. There are 3 groups of jaundice based on the mechanism of accumulation of bilirubin. We can have an overproduction of bilirubin, decreased conjugation of bilirubin, or impaired excretion of bilirubin. And remember, bilirubin is what is left over when the red blood cells are broken down, and it can be toxic to anybody, not just to newborns, but to everybody. So excreting that bilirubin and breaking it down and not having too much is important to maintain a healthy system. The GI system develops a mucosal barrier to prevent the penetration of harmful substances. The physiologic capacity of the newborn stomach is considerably less than the anatomic capacity, which means that the newborn stomach can hold more milk than it can process. And really, newborns don't need a ton of volume because the breastfed newborns, that is, because the colostrum is full of what they need in those first few days. The infant also lacks sphincter control, hence why we use diapers. And this is also why babies spit up so much. There's a lack of nervous system control of the stomach, which leads to regurgitation and uncoordinated peristaltic activity. To gain weight, the newborn needs 108 calories per kilogram per day from birth to about 6 months old. One of the ways we can determine whether or not a breastfed baby is getting enough milk is by the poops and the pees. And you will hear this again, but we have parents count how many dirty diapers they have, because if there's something coming out, it means there's something going in. So speaking of diapers, doesn't this picture want to make you go eat some lunch? So the first stool is the meconium, and you can see that here in this picture. And it's essentially just the broken down red blood cells. It's dark and tarry in appearance, and it's very sticky. So if we know that a baby has passed the first meconium, we're going to want to, or any meconium, we're going to want to clean it up as quickly as possible, because once it gets dried up a little bit, it's very hard to get off the baby's skin. Meconium is sterile since no bacteria has been introduced into the gut before the delivery of the baby. Breastfed newborns have stools that are yellow gold in color. They're loose, stringy to pasty, and kind of sour smelling, but not bad, just kind of sour smelling. And you can see that here. And you can see some of the little chunks. So sometimes breastfed baby stools look like they have a little bit of rice in them. Formula-fed newborns have yellow to yellow-green stools. That's going to be this diaper here. And those are going to be loose, pasty, they could be formed, and they will have an unpleasant odor. We need to know what we're looking at from an appropriate stool perspective, so we know when we see something that's not right. The newborn has a limited ability to concentrate its urine until about 3 months of age. So the urine's just going to have a low specific gravity for a while. I mentioned before how we're going to count the diapers to ensure appropriate intake. So we can expect between 6 to 8 voids per day for a healthy newborn. Babies have a low glomerular filtration rate and limited excretion and conservation capacity. So this can impact and affect the newborn's ability to excrete salt, water loads, and drugs. So we need to be careful what goes into those newborns because they might not be able to get it out. The immune system serves three purposes: defense, which is protection from invading organisms; homeostasis, which is elimination of the worn-out host cells; and surveillance, which is recognition and removal of enemy cells. Natural immunity includes physical barriers, chemical barriers, and resident non-pathologic organisms. Acquired immunity is the development of circulating immunoglobulins. So we get the formation of activated lymphocytes. It's absent until after the first invasion by a foreign organism or toxin. Newborns are primarily dependent on three immunoglobulins: IgG, IgA, and IgM. The most important function of the integumentary system is protection. The integumentary system limits loss of water. It prevents the absorption of harmful agents into the bloodstream. It protects thermoregulation and allows for the storage of fat. It protects against physical trauma as well. Remember, the integumentary system is the largest human organ and our first line of defense. So, protection is the primary function of the integumentary system. The development of the neurological systems follows a cephalocaudal, which means head to toe, and proximal distal patterns of development. Newborns have acute senses of hearing, smell, and taste when they're born, whereas vision is incomplete at birth. They only have the ability to focus on objects in close proximity. They can pretty much see from about the breast to the mom's face. Seems about right. The adaptations we see in the respiratory, circulatory, thermoregulatory, and musculoskeletal systems indirectly indicate central nervous system transition. And there are many reflexes present at birth. These reflexes indicate neurologic development and function. And there's a great Khan Academy video on reflexes that you can watch. So when we talk about the behavioral patterns of newborns, it's broken up into three main phases. We have the first period of reactivity, a period of decreased responsiveness, and the second period of reactivity. The first period of reactivity starts from birth, and it lasts for about 30 minutes. It can last up for 2 hours, but typical is 30 minutes. The newborn is alert, moving, and may appear hungry. They are not hungry because they don't understand that feeling yet, and they just came off a 24/7 placental buffet. But they do have the desire to suck, which makes them appear hungry. The period of decreased responsiveness follows the first period of reactivity, and it's a period of sleep or decreased activity. The second period of reactivity is between 2 and 8 hours of extrauterine life. During this time, the newborn awakens and shows an interest in stimuli. So think about when would be the best time to try to initiate breastfeeding. What do you think? So what are your key takeaways regarding newborn transition? The newborn goes through many transitions and adaptations during the first few hours of extrauterine life. Major changes occur for the cardiovascular and the respiratory systems, and thermoregulation is important to avoid cold stress. All systems continue to grow and develop long after the birth of the baby. Well, thank you for listening to this lecture on newborn transition. I hope you wrote down any questions that you had along the way. Feel free to post them in the student forum or bring them to our next class meeting and we can talk about them. I hope you have a great rest of your day.